Thank you very much, Dr. Finer.
Every year, more than 40,000 people in Britain have hip replacement surgery. It's the final option for people who have diseased or worn-out hip joints. As my friend here demonstrates, a good hip joint is essential for mobility. This is usually what replaces a worn-out hip: a plastic socket in the pelvis and a metal ball cemented into the femur. The problem is that the plastic cup can wear out. 1 in 10 of these operations fails after 10 years. And because of the amount of bone that's been cut away, this operation can only be done twice, and a second hip replacement has an even shorter lifespan than the first. Now there's an alternative to hip replacement that should last longer, making it ideal for younger patients. Orthopaedic surgeon David McMinn has pioneered the new hip resurfacing procedure. He's performed over 1,200 hip resurfacing operations in the past 5 years. The average age of his patients is 48, compared to 65 for those having conventional hip replacements.
Since I've had the implant, I have seriously got my quality of life back 100%.
I've had my right hip replaced and my left hip resurfaced. The resurfaced hip is certainly more comfortable with less pain, and I'm able to do more with it.
The Birmingham Hip Resurfacing involves preparing the femoral head, not cutting it off, and putting a new surface over the femoral head to replace the worn-out articular cartilage. And that articulates against a new metal shell, which is also put on the socket. That gets rid of pain and allows restoration of function.
Experiments in the early 60s found that metal-on-metal hip replacements were highly durable but were prone to friction, causing them to seize up or loosen, so they were abandoned in favour of metal-on-plastic joints, which are smoother and still in use today. However, metal-on-plastic joints have a limited life as the plastic eventually wears down. But when removed from patients, old all-metal joints, some over 25 years of age, were found to be in perfect condition. David McMinn turned detective.
Hip resurfacing is not a new concept, but we have had good evidence from the past that the bearings of metal-on-metal total hip replacements wear very little. And that gave me the idea to mix the metallurgy of the metal-on-metal joint with the resurfacing concept. And we eventually arrived at the Birmingham Hip Resurfacing, and the few retrievals that we have of this implant show that the bearing is completely unworn. And that leads us to believe that even patients with a high activity level will not be capable of wearing out this hip.
We just practice the drops.
Top professional coach and international badminton player David Eddy was advised that he was too young to have a hip replacement.
When I was 45, I found that the hip was becoming progressively worse. I couldn't put my socks on properly, and it was painful. I was limping badly. Life was getting progressively worse, and I could see that the future was fairly bleak.
After a painful hip replacement operation in 1995, 62-year-old Clement Gibson opted for resurfacing when his second hip needed treatment.
2 years after I'd had the first operation, my left hip began to give me trouble. I had heard that there was a method which was being used in Birmingham. My surgeon rather pooh-poohed this idea, but I went ahead and I saw Mr. McMinn, and he agreed to do the operation. And I must say, post-operatively, it gives you far less pain. In fact, after a couple of days, I wasn't taking painkillers at all.
Vigorous exercise is not advised for people with a conventional hip replacement, as it can lead to premature wear and loosening of the joint. David McMinn believes the reverse is true for his implant, as exercise may prolong its life by improving bone density in the femur, bone that hasn't been removed.
It's part of my body, which unfortunately the replacement hip never quite gets to. And, you know, if I'd had a choice, I would have had my first operation and had it resurfaced. But, you know, I'm now playing golf and I'm lowering my handicap a tiny bit.
Since I've had it done, I've won a number of sporting awards, mainly at badminton, national championships, European Veterans Championships, World Masters Championships.
Hip resurfacing removes very little bone, so if deterioration does occur later, a hip replacement can still be carried out, whereas resurfacing cannot be done if the hip has already been replaced. But the British Orthopaedic Association has reservations about the resurfacing procedure. It's an exciting prospect, but the case is not proven as the follow-up study of the implant has not produced any better results than existing models.
Our 5-year patients who are coming through for review are delighted with the outcome of their surgery. Their x-rays show no warning signs for the future. But of course, the final proof will take another 20 years.
The Birmingham Hip Resurfacing technique is available on the NHS, but a conventional hip operation costs £4,000. This procedure costs £7,750, and only 34 surgeons have so far been trained in the technique, so there's a waiting list.
And the implant is only suitable for 1 in 5 patients needing hip replacement surgery because successful resurfacing requires good quality bone to support the implant.
Now, meet David Walker, judo champion and hip patient in 1995. Last October, David won the gold medal in the British Masters Judo competition. In the past 4 years, he's entered 35 competitions and won 27 gold medals, and I'm scared of him. Put that man down, David. Come over here. How old were you when you realised you had a problem?
About 32.
That's quite young. So were you too young for a conventional hip replacement?
Yeah, much too young.
What did they say?
They said it would be at least me late 40s to early 50s before I could even think about it.
Right, and how have you been with this?
On top of the world.
You were back to sport pretty quickly, weren't you?
Within 12 weeks, yeah.
That's fantastic. And you've won a few medals since?
Altogether, I won about 30 odd. I just took a silver in the Worlds. And,
He's so modest. He's number 2 in the world.